Hello guys, welcome back to another live session. Today we are having a really interesting topic. The topic is gestational diabetes. Gestational diabetes. So I'm going to give like a few minutes for those who are just joining to join us. Please do well to join us as soon as possible because we are talking about a really important topic today. The topic is gestational diabetes, and I'm just getting my stuffs ready so that I start the presentation. And if you happen to watch this presentation later, do well to please like the video and do the normal things. I'm also just trying to ensure that everything is fine. That's why I'm on my phone. I'm trying to let's see, and also waiting for others to join. So guys, welcome to my channel. I am Carlson. Okay. Yeah. So I can. Okay. So I can hear myself. Okay. Yeah. So everything works well. So welcome to my channel. I am Carlson. I am a registered nurse here in Helsinki, Finland, and also I'm also a MSN student. So I'm doing my master's degree in nursing as well. I'm specialized in welfare technology. So if you are meeting me for the first time, welcome, and you are in the right spot. Today we are talking about gestational diabetes, and it's a very important topic that I really want to dwell in. So, like I said before, this channel we are always going to be talking about health tips and living right, and also we are talking about traveling abroad. So, if these are things that interest you, please do well to subscribe and keep following the channel. I'm going to go dive straight to the presentation of today, our presentation of today, because we have a really important topic that I really want to share with you guys, which is called gestational diabetes. What is gestational diabetes and all those things? So, um, yeah, so maybe I'll give like few minutes for people to join, and when you join, please where you watching from. I would like to get these answers. Know where you are watching from, and maybe a small introduction of maybe your name. What is your what is your and you are, yeah, or kind of maybe introduce yourself. So let's say what's your name. Let's put like that name. Let's see. So like that. So I'm just going to put like I'm just going to wait for a few minutes so I can go ahead with the presentation of today. Um, yeah, I don't want to keep going back and forth. That's why I I I prefer to wait a little bit because I know when people are going to join, when they start joining, they will start asking questions, and I don't want to go back and forth with this presentation. So that's why. Um, yeah. So I'm also posting these things on my social media handle so that people can 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 join. Okay, so anyways, I'm just going to go straight with this. What is gestational diabetes? I'm sure you might be wondering what is Carson talking about. So today, we are going to go into this because I have noticed that there is a gap of knowledge in what's called gestational diabetes. A lot of us, most of us, let's say, um, don't know what is called gestational diabetes, and some of us think that it is just a female thing. I believe if as a man you are supposed to know about these things because of course gestational diabetes happens only during pregnancy, but it would feel nice. It would be like so great if you as a man can assist your wife during pregnancy, and if she doesn't know about these things, kind of educate her on this. So I'm going to kick on the presentation now with by sharing my screen. I prepared the presentation already, so I'm just gonna take. Let's see where is it. Mm, let's see. Let me get to that presentation that I made away. Or this thing is it? Let's see. Let's see. Where is it? Um. Okay. One moment, please. It's just like okay. Let me go to window. Um. Okay. So let's go to yeah. I hope you can see my screen. So I'm going to go on to make the presentation like this. So when we talk of gestational diabetes, I'm sure you might be wondering what is actually this thing. So let me just be sure that it is you. Okay. So gestational diabetes, like you can see, gestational diabetes is something that occurs principally during pregnancy, and it is actually insulin, uh let's say insulin mismanagement. So when you are pregnant, we know that you are carrying a baby with you, or in you, you're having like let's say you have a baby. Okay, so it means that the insulin demand that your body needs to produce are sometimes not matching with the recent demand of your body. So that creates a gap. Okay, so that creates a gap whereby maybe your body start producing so much insulin, that's a pancreas start producing so much insulin that it is too much for your body. And what happens is that so much insulin makes now, sorry, your body start producing so less insulin, sorry. So when we know that insulin is actually like let's say if you are eating a lot of sugar, let's say you have diabetes, a normal diabetes, type 1 or type 2. Let's say you have type 2 diabetes, because type 2 diabetes is easily or type 1 diabetes, which is easily managed by with insulin. So if you have a diabetic, if you are diagnosed to be diabetic, for example, and then you kind of use insulin to bring down your blood sugar, because normally your pancreas are supposed to produce enough insulin that is supposed to be sufficient to control your sugar levels. And we know that once you have abnormal sugar levels, it's not good for your system. So let's go to what is really happening. So when we talk of diabetes, gestational diabetes, we know that this is a situation that commonly happens only during pregnancy. Okay, so when you hear of diabetes, gestational diabetes mellitus, it only happens during pregnancy. So we don't talk about diabetes, gestational diabetes, in any other situation apart of when you are pregnant. The second thing we have to know is that it is when the pancreas is unable to deal with the increased insulin requirement during pregnancy. What do we mean? It means that when you are pregnant, the amount of insulin that your body is supposed to produce, it actually increases, because you know when you're pregnant you consume more, and of course your insulin, or that is your pancreas, are supposed to produce enough insulin that matches up with your insulin demand, with your, so that it balances up with the amount of sugar that is supposed to be in your body. Now, when this does not occur, it leads to what is called gestational diabetes, which is, in other words, diabetes during pregnancy. But the contradictory thing is that you can be diabetic during pregnancy, and after pregnancy, you might not be diabetic. Okay, so it doesn't mean that if you have the gestational diabetes, you will have diabetes. Anyway, I'm going to talk more on that maybe in the later slides, or maybe at the conclusion, to give you a round up. But anyways, it mostly occurs during the second and third period of pregnancy, and this is, we always do this test between week 16 and week 24. About those periods, we do what is called the glucose tolerance test. So we kind of test your glucose tolerance levels to see if you will be if you have risks of the gestational diabetes or not. So, and then the other thing is that it is a very common thing that happens around the world. So if you can see from here, it shows that about 2 to 3% of women are in United States. They have this, and just imagine United States. They are always taking this data into consideration, and 2 to 3% of women they are diagnosed of this in United States. Imagine other countries, other areas of the world whereby they don't really pay attention to this. So I'm going to also give you guys um, other areas in the world where people are equally at high risk of being getting gestational diabetes. Also, what are the risk factors? When you are looking at these things, you are always wondering what are the things that makes you or places you at risk of getting the gestational diabetes. The first thing that you ought to know is lack of physical exercise. You know that the it is said that exercise is like insulin. So every time you go for an exercise, every time you walk, you are helping your body to compensate for insulin. So lack of physical exercise makes it difficult for makes it difficult for your system to produce insulin. So now, when you are not exercising, it means that you are not helping your system to produce enough insulin for 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 your pancreas, for example, to fight against the high levels of sugar that you might have in your body. So lack of physical exercise is one of the problems. The second thing is being overweight. Overweight simply means that if your body BMI, that is a body mass index, is greater than 25, it means that you are overweight, so you are diabetes. So if you have like a obese, sorry, if you are an obese person, you are at risk of getting this gestational diabetes. The other thing, of course, which is so important, is history of pre-diabetes. So, and I'm going to put it together with prior gestational diabetes, which you might have had during your previous pregnancies. Those things put you at risk of getting gestational diabetes. And of course, we also have things like if you had a baby who was overweight. So maybe the last time you gave birth, your baby was maybe, let's say, above 4 grams. So what is usually a thing is like once a baby is above 4 grams, they usually say that the baby is that's kilogram. The baby is of 4,000 kilograms. Sorry, so the baby is overweight. So when you have a baby that was overweight, then that's also an issue. Uh, those of us from Africa, if you are a lady from Africa, India, and also Asian women, you are at risk of getting gestational diabetes because that is your that they call it your generic route puts you at risk of those things. Then we also have what is called hemoglobin A1C. So hemoglobin A1C is something that usually for you to be diagnosed of normal gestational diabetes or for normal diabetes, sorry, you are supposed to be monitored or you take the test which is called hemoglobin A1C. Hemoglobin A1C is kind of a longer period of your blood sugar that is done like in 90 days or we can say 3 months. So that is how we can diagnose you. So if your hemoglobin A1C is more than 7.5, 5.7 means that you are at risk of getting gestational diabetes. Now, what are the assessment? Like earlier, I told you guys, the assessment is usually done depending on the country where you are located. If you are a pregnant woman, most often, of course, in Finland, that's what we normally do during the weeks 24 to 28. The physician calls you in to do what is called the glucose tolerance test. It's actually a two test. So the first test will be like it's not fasting. You just come in the morning and you are given a huge amount of maybe a sweet drink to take in, and then after about 1 hour, your glucose or your sugar level will be measured. And if I'm not going to call a range because depending on the country as well, they have different ranges of what is required. So once that range is inside or within what they want, then you are not going to go for they call it 3 hours glucose test. So what we do, if the first one is abnormal, then the second test will tell you now to do what is called 8 hours fasting. So you have to fast for 8 hours before coming in for that test. And that test you have to do it like you take a shot of sweet juice or something. Then later on, they will measure it again to see what was the value, and from there, they can now diagnose you of being gestational diabetes or gestational diabetes or something like that. Anyways, and then also what is usually done as a normal pregnancy routine is that they always do the glucose urine test to see if there is glucose in your urine. Of course, normally a normal person shouldn't have glucose in his or her urine. So you having glucose in your urine is kind of a point that might be saying that suspecting that you are at risk of or you might have this gestational diabetes. But it is very important to emphasize that just your glucose in your urine doesn't mean that you have gestational diabetes. So the next thing that we might be thinking of is the what are the complications? Of course, the number one thing when it comes to gestational diabetes complications are first microsomia. What is microsomia? Microsomia is just when the baby is too big. When a baby is too big, it becomes so difficult and it makes the labor process or delivery process so complicated and of course very long. You know that when the delivery process is so long and complicated, it makes it difficult for the woman, and of course it might lead to things like c-section, soldier dystocia, which is a situation whereby the soldier is unable to come out from the woman's womb. So all those things, it makes it so difficult for during delivery. Look at the head of this child. Imagine you have to give birth, you have to give push this child like to go give birth vaginally with this kind of thing, this kind of child with this kind of head. It's so difficult for the woman to push the baby out, and look at the length of the soldier. So it makes it so difficult for the child to rotate the soldier so that it really comes out and have a natural vaginal birth. So this is so difficult and complicated when stuff like this happen. The next thing is also called the another complication that might happen is also called preeclampsia. Preeclampsia is just let me just put it in the simplest term that you can understand. It just means that high blood pressure during pregnancy. So you know that once you have a blood pressure that is high during pregnancy, it is a very complicated situation, of course, because preeclampsia can lead to eclampsia, and of course, and can lead to severe eclampsia, which are eclampsia has like three stages. So we have the preeclampsia, eclampsia, and severe eclampsia. And with this eclampsia, the woman is at risk of seizures. A lot of seizures can happen, and so many very difficult situations can really go on when a woman is diagnosed of being preeclampsia. And then also we have to remember that this preeclampsia, well, okay, I said it is preeclampsia is high blood pressure in pregnancy, but it doesn't mean that if a woman has just one high blood pressure during pregnancy, she's having preeclampsia. No, it means that you have a consistent uh, um, uh, high blood value. So maybe some physicians want it to, you want the person to have consistent high blood pressures of about maybe 3 times consistently. So imagine that a woman has a high blood pressure of about 150 on 120. So that is called is actually a risk factor of this complication of gestational diabetes. And of course, we have what is called hypoglycemia. Hypoglycemia simply means that the blood sugar is low, and this goes to the baby. You might be surprised and wondering why is it that the woman, when she's pregnant and then she has gestational diabetes, the baby is taking so much sugar, and then when the child is born, the baby instead gets hypoglycemia, which means low blood sugar. This is it's a very simple thing, and some sort of complicated thing as well, because after birth we have to monitor the child very seriously, because hypoglycemia can lead to really damaging side effects to the baby. Now what happens is that once a woman is pregnant and she has gestational diabetes, it means that the baby is receiving too much sugar, which the baby is not supposed to receive that. Now we know our systems, that the system now become used to that. The baby becomes like acquainted to receiving too high levels of sugar, high level of sugar. And when the baby now is born from the like is delivered, now the baby is now in a situation where hey, there's no sugar, like the sugar level that the baby used to consume is no more there, and instead makes to leads to a rapid drop of this and of the baby's sugar level, and this can be very very deadly. And in most situations, women who give birth with these things, babies, women who are diagnosed to be gestational diabetes or who had gestational diabetes during pregnancy, they tend to have a longer stay at the hospital because we want to check the baby's blood sugar to ensure that the baby doesn't have hypoglycemia. Because if the woman is discharged with the baby and baby comes home and she or he has hypoglycemia, this can even lead to death. So it is a very, very complicated situation that has to be seriously monitored and all stuff like that. I already made mention of soldier dystocia. This is also a very important thing. This can lead to severe complication during delivery, and as a woman, you want to avoid this complication if you can. The next thing you might be asking is, okay, Carlson, I have gestational diabetes. How can I manage the situation? Gestational diabetes luckily is manageable. It's manageable and is so easy to manage gestational diabetes. So managing gestational diabetes, most physicians they go with what is called we always start with known with less how what is the word with less pharmacological methods. Let's say we don't go straight to pharmacology to get the herb. We go more of like I just forgot the word, but what I mean is that we don't go with pharmacology first. So pharmacological things means that we don't go straight by giving you medication. We start with exercise and diet. And most people, it's more recommended for people to regulate their gestational diabetes with exercise and diet because it is very easy. And if the woman is strict with her exercise and diet, she is going to be so perfectly fine and will not have any problem during her period, her pregnancy period. But if she is not able to manage the situation with the exercise and diet, then there is a problem. There is a problem because that is when the physician might want to prescribe medications, and of course she might end up having daily insulin to manage her sugar levels and all those things. So it is easily manageable with exercise and diet. And but if it's out of hand, then if the woman is not able to do that, she has to do what is called uh, daily glucose control. That means that every time she eats, she has to take her blood sugar to check what are the values, and then maybe maybe use some sort of insulin. Of course, we have different kind of insulin. We have long acting insulin, short acting insulin, and of course the 24 hours acting insulin. So and the intermediate acting insulin. So it depends on what kind of what the doctor prescribes, but it is easily manageable. That is a good news. So I've come to the end of this presentation. I think I've said all things that needed to be discussed in this presentation. When it comes to gestational diabetes, those are the things that you want to know. Those are the things that you want to keep in mind because it is gestational diabetes is a very serious issue, and I think that most people are not really aware of this. And yeah, I would want to answer questions. I would want to answer questions. If you are just joining me, I just did a presentation on gestational diabetes. I talked about what is gestational diabetes, what are the causes, what are the risk factors, and I talked about how gestational diabetes is being managed. If you have a question, you can ask me. Um, it doesn't mean that if you are not pregnant, you shouldn't listen to a very important lecture like this. You have to know about these things, even if so that you can help yourself and your, maybe if your wife is pregnant. If you want to join me live, I'm just going to put the link here. You can join me live and ask me your questions by clicking this link. Click this link and join me live. So if you have a question, you can ask. And if you have a contribution, of course, I will be welcome to receive it. And also, please, if you are new in the channel, please do well to like, share, subscribe on the channel so that you keep receiving really, really useful informations like this. And I'm going to, in the next one, I will be talking about eclampsia. We slightly made mention of what is eclampsia. I'm going to be talking about eclampsia in my next upcoming video. So I think these are really, really, really. I For the start from now, I want to talk about all the complications that comes with pregnancy, everything pregnancy, and then after that, we are going to dive more into other several really, really important health topics. So, guys, I think this is a very, very important education that I'm giving out there for free. If you are live, please. Come on live if you have a question or if you have any contribution in regards to gestational diabetes. If you have, maybe you had gestational diabetes, you were diagnosed with gestational diabetes when you were pregnant, you want to share your experience with me, how you managed it and you got through your process and everything. You want to share that with me? Come on live and let's have a chat. Is there anyone who wants to come live and have a chat with me about these things? So that in the next couple of minutes, if there is no one, I hope this presentation was really, really interesting. I hope it helped you or is going to help you maybe in the future if you get pregnant and you don't know these things. Maybe you can refer back to it. Like I said, the most important thing is that you should know that gestational diabetes is manageable. It's manageable, and the two most important thing is that you can do it with exercise, and the second one is diet. So we use what is called the DIE model to manage gestational diabetes. So it is managed with that. Of course, if your diet is so poor, you are eating too much carbohydrates like all those starchy food, bread, in Africa we eat fufu, the cassava and all those things. It makes you become too starchy, and starchy things are content of sugar. As such, your sugar levels are always going to be up. But if you can manage that by eating healthy doesn't mean that you wouldn't eat what you like, but at least you should eat um, things eat small quantity and eat in as many times as possible. We usually prefer the six time meal schedule, rather than eating twice a day with so much heavy calorie content. It's better to reduce the meals to six, and then you eat in that manner. It helps to regulate your sugar levels and all those things. But yeah, so thank you guys for all of you who were active during the session. I and It's been a great session in my opinion, and I'm going to record. It's been recorded. I'm going to post it online. I'm going to publish it. And so guys, please do the normal things. If you are not yet a member of this family, be a member, and let's keep on sharing the knowledge that we are acquiring to others who are not privileged to get this knowledge. Like I said, I am Carlson. I'm a registered nurse here in Finland, Helsinki. I'm also a master student in nursing as well. I'm soon graduating, so I it's my pleasure to share with you the knowledge that I've been getting from my experiences and from my studies as well. So thank you guys for being part of this journey, and see you in the next one. Ciao. Bye.